Exams, vaccinations, screenings, and so much more will be offered at Chicago's largest Latino health fiesta coming up next week.
Here with more on why this event is so important for the community and for women in particular is hematologist and oncologist Dr. Claudia Tellez, and Alcoa One Chief Operating Officer Karthik Achari. Thank you both for coming in.
Thank you
Thanks for having us.
Thank
We were
you.
just talking, an ounce of prevention is worth a pound of cure, and that's really what the concept is behind this event. Talk a little bit more about what exactly will be going on.
Right. Thank you so much for having us today, by the way.
Thank you.
So on Saturday morning, we are hoping to gather a large number of Latinos to expose them to education, to screening, talk about diet and exercise, talk about vaccination. This event has been going on for several years, and it's been very successful for the community.
And Karthik, tell us a little bit about your role in this entire event.
So my role in this event is Alcoa's focus is on preventative medicine. At the event, we're going to be targeting our most underserved populations of Chicago and providing them access to hereditary cancer screenings. Our underserved populations, especially our brown populations, do not really have the best access to the care, the best knowledge. There's a lack of knowledge in regards to this hereditary cancer.
And fear.
Exactly.
Yeah.
Yes, yes. And what we're able to do is show them or educate them rather on the opportunities that they have to get tested for hereditary cancer, and we provide them with pathways to care after giving them the opportunity to get screened and tested.
That they necessarily may not have been aware of that needs attention right away.
Exactly.
And in that effort, you're targeting 150 women?
That's correct. So we will have providers that will be performing breast cancer examinations. And Karthik will have a team that will also be doing the actual screening, genetic screening as well.
And I know we're focusing on women right now, but we also need to include men in this process as well, not only with breast cancer, but also there's going to be mental health screenings and prostate cancer screenings too.
Correct.
Okay, so tell us a little bit about that.
So the biggest focus here is on BRCA1 and BRCA2. Those are the genetic markers that we look for to test and see if people have a genetic predisposition for breast cancer, ovarian cancer, things like prostate cancer, and things of that nature.
And once you come up with that information, depending on where they are in this process, hopefully none are in that, but if they are in the throes of this disease or this illness, what are outcomes looking like now?
That's correct. So once we identify that a patient has an increased susceptibility to cancer, then we connect them to the appropriate resources to do then early screening. That then is going to be very important. For instance, the PSA testing for the prostate cancers, the mammogram screenings for the breast cancer, and the pap smears for the cervical cancer.
If someone's watching right now and they're not only frightened to go and have themselves checked out, but they're concerned about their status as a citizen and whether, you know, they're frightened. What would you say to them?
Absolutely. So they don't have to worry about status. They're welcome to participate. We will not require any documentation at all. This is open for everyone.
So how does this take place? Is this a blood test? Is this a mouth swab? How does this screening happen?
So it depends. Of course, we're going to actually be doing physical breast examinations at the fair. The genetic testing is actually a mouth swab.
Yes.
The testing can also be done through blood, but the one that will be performed at the fair will be through a swab.
Yes.
Yeah. Oh, go ahead.
No. I was just going to say, so that has got to ease a lot of fears because a lot of people don't like the
Absolutely.
syringes, they don't like the
Yes.
needles.
Yeah,
sure.
I know.
It removes a big fear factor because a lot of people don't want anything
Right.
invasive or anything like that.
Yes.
But something as simple as a swab, if they if they meet the requirements through a screening, it's very simple, and it has the potential to save that person's life in the future.
Well, you are doing incredible work. Thank you
Thank you.
so much for being here with
Thank
us
you
today.
so much for having
Thank
us.
you.
Yes.
There's all the information for Latino Family Wellness and Health Equity Fiesta Tour. It's this Saturday, August 12th, 9 to 2 p.m. at 2520 South Western Avenue. Just check out the website there for all the information. There's a phone number you can call too. Thank you so much for joining us, Dr. Claudia and Dr. Karthik. Really appreciate it.
And if I may I just add, we also will be starting a new breast cancer Latinx clinic at Northwestern starting
Yes.
September 1st as well.
Fabulous.
So I wanted to put in that plug.
Yes,
as well.
absolutely.
Thank
Get the
you so much.
information